morning. Welcome back to Open Med School. Added sounds, examination respiratory system, crackles or crepitations. That is today's topic. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. The last session we have discussed about the bronchial breathing. Today I'll be discussing about the added sounds. The main added sounds are crackles, rhonchi, stridor, pleural rep, etc. So today's topic is crackles. So what are crackles? The crackles are interrupted sounds and they are discontinuous, non-musical. These are the 2 or 3 terms you should remember. They are discontinuous, non-musical sounds. They are called added sounds because they are added on the normal breath sound. So this is what you should remember. So added sounds are additional sounds heard on auscultation, and the definition I have told you, it is produced due to explosive reopening of the closed airways or due to fluid passing through, not fluid, air passing through fluid filled spaces. So if you take the airways, if there are secretions are there here, and when the air flows, you get sounds. This can occur in inspiration, and when the air is passing during exhalation, again the sound is produced. So usually crepitations which are heard both in inspiration and expiration are due to fluid filled air spaces through which when air is passing, there is bubbling is occurring. Others are due to explosive, discontinuous sounds occurring during inspiration, generally due to sudden opening of the collapsed airways or by the movement of air through the secretions. So basically, we should understand that there are 2 mechanisms for the production of the or genesis of crackles. One is sudden airway opening, second is air bubbling. So this is the airway, remember, and if there is filled with fluid, then movement will produce, bubbling will produce. This second mechanism is more common in bronchiectasis, sometimes in chronic bronchitis. So we have discussed about the genesis. I will represent it with a picture. So here you can see, suppose this is the bronchus or the small airways. Fluid is there. During inspiration, the sound occurs. During expiration, also the bubbling occurs and you get sound. So if they are getting the crackles during expiration, that definitely means that it is due to fluid passing, air passing will produce the crackling sound to bubbling occurring. Hope these 2 things you understood. Then if you go to classification of the bronchial sound, it can be based on the pitch, it can be based on the phase of respiration. So first we take the phase of respiration and classify it. So the crepitations has here, you can occur in the early part of inspiration, middle part of inspiration, or the late part of inspiration, or it can be expiration. So it is early inspiratory crepitations, mid-inspiratory, late inspiratory, and expiratory. So this is one way of looking into the crepitations. So early inspiratory crepitations or early inspiratory crackles, you draw the inspiration, draw the expiration, it occurs in the early part. So this occurs when the air is entering through the airways even before it reaches the alveoli. It is not due to explosive reopening of the alveoli. It is occurring usually due to the early part when the air is moving through the airways. So air is moving, it is producing. So this classically occurs in bronchiolitis. It can also occur in chronic bronchitis, asthma, so bronchiolitis. These are the causes. It is due to opening of the proximal bronchi which have been narrowed by mucus or inflammation. So look at Hutchison's statement. Early inspiratory crackles are usually coarse and are produced by the sudden opening of large, more proximal airways which have closed prematurely during expiration. So hope you understood the early crepitations. So early crepitations or early inspiratory crepitations are seen in bronchiolitis, can occur in COPD and also in asthma. Now we go to the mid-inspiratory crackles. Mid-inspiratory crackles appear midway. So if this is the inspiration, this is expiration, it is occurring in the middle part. Less common, usually can occur in bronchiectasis, pulmonary edema, and some cases of asthma. Now we go to the late inspiratory crackles. So this is occurring in the later part of inspiration. So it is a classically one condition is the interstitial fibrosis. They are fine and high pitched. And sometimes it will appear like that of Velcro and they are called Velcro cups. Velcro like sound you can get. So the typical example is a pulmonary fibrosis. You can get in pulmonary edema and you can get in atelectasis. So these are the points you remember. Then expiratory crepitations is no, this is the inspiration, this is the expiration. Creps are occurring in predominantly here. So this is usually due to air bubbling through the secretions, bronchiectasis, chronic bronchitis. But again, remember that the compared to the bronchi, the location classification of crackles is a little difficult. Even in the era of artificial intelligence, it is difficult to identify, and the significance has to be correlated with the clinical findings. Now we classify depending upon the pitch of the sound. You divide into fine crackles. They are soft, high-pitched sounds, usually occurring in late inspiration. So late inspiratory crepitations are usually fine crepitations, and coarse crepitations are usually due to when the air is passing through the airways and the airway contains secretions it produces. Coarse crepitations, they are low pitch sounds. So coarse crackles are loud, low pitch sounds, early to mid inspiratory and plus minus in expiration. So you can say in expiration and also heard in the middle and later part of inspiration you get typical condition. Remember is bronchiectasis, resolving or pulmonary edema you can get. So there's some stages of pneumonia also you can get. So now we have understood the characteristic features of crackles and how to classify into fine and coarse crepitations. And one peculiar type of crepitation is the what is called the Velcro creps. Again, Velcro creps are fine crepitations. They are heard in the usually in the end of inspiration, end inspiratory sounds. So this is classical feature you get in interstitial fibrosis that you should remember. Now going into this is the tabular form in which you can identify these different types of crepitations. They are first is classification, early inspiratory, mid inspiratory, late inspiratory, and expiratory. And the common important cause, you remember the coarse crepitations. So classically seen in bronchiectasis, Velcro creps in pulmonary fibrosis. So you can pause the video and note down the features of various types of crepitations. Now think about the where will you get it. So this classically in pulmonary edema, it is seen in the basal. It's a basal crepitations, and this can change with the coughing. So location, timing, and quality, and change with the post-on coughings are important for diagnosis. So basic crepitations are seen in or heard in pulmonary edema. Hope this point is clear to you. So it's a mnemonic, fine in fibrosis, coarse in congestion. So can you easily remember fine crepitations occur in interstitial fibrosis, coarse crepitations in secretions or alveoli, sometimes called wet sound. This is a summary table which already I have shown to you. So brief one. The common causes: fine crackles, fibrosis. Now the clinical parts, they are auscultate in a quiet room, patient breathing, mouth open, little deep breathing, listen to multiple areas, look at the different positions, look at the variation with the cough. Document the timing, whether it is inspiratory or expiratory, and different postures.